Hello everyone, my name is Savannah Cutting, and today we'll be discussing some major clinical pearls associated with psoriasis as we prepare for the PANTS. Today we will discuss some of the general features about this condition, clinical assessment, which includes various signs and symptoms to look for during a physical examination, how to diagnose it, as well as some treatment and preventative options for our patients. Thanks for listening, and let's dive into it. First, we will discuss some of the general features of psoriasis. Psoriasis is described as a multisystemic disease from skin inflammation and epidermal hyperplasia. The word psoriasis was actually derived by the Greek word psora, which means itching. There are numerous risk factors that can trigger psoriasis flares, some including certain medications, such as lithium, anti-malarial medications, indomethacin, etc. Others include obesity, family history, skin trauma, various viral or bacterial infections, smoking, alcohol use, or stress. So you may be asking, what causes this? Well, keratinocytes are triggered by certain stressors or trauma to the skin, which then activates other cell types. These cell types include T lymphocytes, dendritic cells, and cytokines, which play a key role in the inflammation process. T cells are activated and release cytokines that proliferate keratinocytes, furthering inflammation and plaques that lead to a chronic phase of psoriasis. This hyperproliferation and vascular dilation causes the scaling and erythema as seen in psoriasis patients. Now that we know the etiology and pathophysiology behind this condition, let's talk about the various types of psoriasis. Psoriasis vulgaris, or plaque psoriasis, is the most common type of psoriasis. This is described as well-demarcated pruritic plaques with an overlying thick silver scaling, most commonly seen on extensor surfaces of the skin. The plaques may appear different depending on your patient's skin color. This can range from pink on lighter skin to brown or gray on darker skin. Once the plaques heal, hyper or hypopigmentation can occur as a result. Some plaque psoriasis key findings include Kober phenomenon and Auschwitz sign. Kober phenomenon is the development or worsening of skin lesions in sites of injury of the skin. Auschwitz sign is pinpoint bleeding after scales or plaques of skin are removed or scraped. Some other types of psoriasis include inverse psoriasis, that's located in major skin folds such as the axial and inguinal areas, pustular psoriasis, which appears as painful, yellow, and pus-filled spots, Gouted psoriasis, which is described as the abrupt appearance of small and scaly raised plaques with a silver or gray covering that can appear on the proximal extremities or on the trunk. This is most commonly seen after recent bacterial infections. Psoriatic arthritis can develop in 40% of our patients with psoriasis. This presents as inflammation of various joints that can cause swelling, pain, or stiffness. Now let's get into how to diagnose this condition. Because psoriasis can present very similarly to other skin conditions, it may be hard to diagnose clinically. A thorough history and physical examination can assist in making the diagnosis of psoriasis. Though not necessary, a skin biopsy can be used to differentiate psoriasis from other skin conditions if the condition is still unclear after your thorough examination of the patient. The total body surface area is commonly used to guide the treatment plans for patients. This includes mild, moderate, or severe psoriasis. As pictured here, you can see that mild psoriasis is less than 3% total body surface area, moderate is 3 to 10%, and severe is greater than 10%. The Psoriasis Area Severity Index, or PASI, measures the severity by using the extensive erythema, scales, thickness of the plaques, and the BSA value. This is a standardized tool used to evaluate the success rate of various treatments, as well as disease severity over time. As depicted in the image here, we can see that each region is given a score from 0 to 4. 0 has no involvement, and 4 has the most severe involvement. The scores given for each specific region are multiplied by a factor representing the portion of the BSA represented by that region. We will now discuss various treatment options. Though psoriasis cannot be cured, it can be managed with various therapeutic options. Long-term management of psoriasis is suggested because of the chronic exacerbations over time. The treatment options are based on disease severity. Mild to moderate disease can be managed with vitamin D derivatives, topical retinoids, or high-potency corticosteroids. Moderate to severe disease warrants UV therapy or systemic therapy, such as cyclosporin or methotrexate. Psoriatic arthritis can be managed with various pharmacologic agents depending on disease severity. These options include NSAIDs, steroid injections, DMARDs, or biologics. Early interventions with physical or occupational therapy can also optimize the function of these areas. Psoriatic skin may be kept moist, or should be kept moist, to alleviate symptoms of pruritus and tenderness. Most hydrating emollients are available over the counter and can be very inexpensive for these patients. Some include moisturizing creams or lotions, such as CeraVe moisturizers, Aveeno, or Cetaphil. Just ensure that they're fragrance-free and hypoallergenic to reduce irritation. Ointments that are thicker and provide a more occlusive barrier to lock in moisture can be very helpful for these patients. This can include Vaseline or Aquaphor. Other agents used could be natural oils such as coconut oil or almond oil. Though there's no way to prevent psoriasis flares, there are always ways to keep it under control. This will allow for patients to reduce their psoriasis flares and lower their risk of developing certain comorbidities. The best way to control psoriasis is by medication and therapy compliance. Avoiding certain triggers such as stressful situations or certain medications can significantly improve symptoms over time. For symptomatic improvement of pruritus, patients can ensure that skin is kept soft with frequent baths and thick ointments. Some modifiable risk factors that can reduce the severity of psoriasis disease states include smoking cessation, increasing physical activity, reducing alcohol consumption, or weight loss in overweight individuals. Because this disease involves chronic inflammation, it can affect multiple organ systems over time. This can increase the overall risk of mortality and morbidity. The various health conditions associated with psoriasis include cardiovascular disease, depression, type 2 diabetes, and other disease states. Psoriatic arthritis is a common complication of psoriasis, as we discussed prior. Suspect psoriatic arthritis in patients who are suffering with tender, stiff, and erythematous or swollen joints. This can lead to reduced mobility and joint damage if left untreated. Make sure to screen these patients with x-rays and blood tests with inflammatory markers. Some treatments used for psoriasis including immunosuppressants and biologics, can have lasting effects. This includes malignancies such as leukemia or lymphoma, various fungal infections, or GI problems. And this is my reference page. Thank you all for listening, and I hope you learned a little bit about what there is to know about psoriasis. I've included my email here for any questions you may have. Have a great week!